Good evening, everybody. This is Dr. Apurv Mehra, and with me is Dr. Piyush Sureka. And every house in India has a dream that there should be a doctor in their house, right? And it sacrifices almost the entire youth of the parents to get a doctor in the house. What we have here is something more phenomenal. We have a person who started his journey from AIMS Bhopal with MBBS, with icing on the cake, with one of the most prestigious colleges of India, Gandhi Medical College, Hyderabad. He gets an MS degree. And then he writes a DNB exam, which actually is very tough nowadays for orthopedics. I don't know why, but the results have not been great, right? And Dr. Piyush, before we go ahead with how you did and what you did, I will request you to take the name of your parents.
So my mother's name is Usha Sureka and my father's name is Anil Sureka.
Fantastic.
So
yeah.
Good afternoon, sir.
So Piyush, is any doctor in your house? Is there any doctor in your house?
No one, sir. No one.
You are going to be the center for next few decades till everybody goes ask you.
Yes, sir.
And take it as a responsibility, as an honor, because your entire family is to trust you for a lot of big decisions in their life. All right.
Yes, sir.
And
yes, sir.
I hope that as an orthopedic surgeon, orthopedic surgeons do save life, but they are basically responsible for improving the quality of life of the community. And I believe that your hands, a lot of trauma patients, a lot of joint patients, lots of sports injury patients, they are healed. And I wish that today I'm talking to you about clearing an exam, but after a decade, we again talk about your clinical skills and something exceptional you do for this field. What made you take orthopedics, Piyush? Why ortho?
So it was my first love since my MBBS and during my internship. So basically, internship shapes what you are more interested in. So basically, in my internship, I had a very good mentor in orthopedics, Dr. John S. Santoshi sir, who shaped my life and he made me fall in love with orthopedics. And since then, I decided that I will land up in orthopedics no matter what my rank is. So since there the journey started, and then I've been in orthopedics since then.
Yeah, apart from as a branch, it gives you two spectrums. It allows you to practice as a clinician, diagnosing and treating with medicines, and it allows you to practice as a surgeon. And anybody who gives an exam in the world, the moment he writes an exam, he waits for a result. But orthopedic surgery is such where your result is declared on the table. You almost know what's going to happen. You fix it, you know the principles are followed, it's going to succeed or not. You replace it, you know what you have done. So this is something that is, we do have a follow-up and that's a learning, but still the results are quicker here. And what is an area of orthopedic that excites you the most?
So arthroscopy and arthroplasty, sir.
That everybody loves nowadays.
Yes, sir.
And which is your favorite joint to work on? Which area?
Knee and shoulder, sir, anytime.
Knee is the largest joint, and you'll do good in India if you work on knee, because most of the problems in India are related to knees. I wish you all the best for your career. Now we'll come to the thing that we started the interview, right? It is absolute honor representing Conceptual Orthopedics team here for this video. My principal aim is that we've been hearing that the exam passing rate is less than 10%, right? And the theory that you cleared was very difficult to clear, and the questions were not from the standard things that they ask, right? So I do understand. What were the three things that you will advise to a student who's writing DNB exam?
Sir, DNB exam is different from all the other exams, because what I feel is DNB was the exam which tested your basics right from A till Z, or from 0 till your 100. So when it comes to skills, or when it comes to doing musculoskeletal imaging, like in MS exam, we didn't have anything like having to go through imaging. But because of DNB, I was keen enough to learn all the MRI readings of joints and arthroplasty in much deeper level. So that is what it makes it different from other exams.
All right. So as you said that this is an exam that actually tests your skills, right?
Yes.
There are 4 papers. There are 4 papers in most of the exams, right?
Yes, sir.
So how did you prepare for each one of them? What was your source when it comes to conceptual orthopedics? How you utilized it as a source?
So my the older practice has always been to study the reference books, the standard books, which obviously is the saying right now as well. But what I would like to advise all the young orthopedics, that once you see like for example, if you go to the app and if you see the videos, the same topic, first you see the video, you will get a pictorial representation of how to understand the topic, and then when you go back and visit your reference books, that makes you understand the topic more better and much easier. So it will if the same topic, if you were studying in 1 hour, now it will take you only half an hour to understand it better. So I would always advise someone, if you are studying any topic from Campbell or something, just same topic, first you just go immediately see the video from conceptual. Your concepts will be built, and then you can anytime go back and study the Campbell. So that is how it makes life easier and understanding more better. So that is my highly recommendation to everyone.
All right. So I'm happy that you spoke that follow the standard textbooks.
Yes,
I'm also happy that you made a point that this only helps you understand that better. So that tells
yes,
you that you are having a good check, you have a
yes,
sort of revision, and you have a better retention. Were you referring to the notes very often of some topics?
Yes, sir. There were many notes which were difficult to find in books, or which were recent advances, which definitely helped me in paper form. So, yeah, I have found a lot of topics for which immediate notes was helpful in the app, which was basically difficult to find in books or in internet or in articles. So, in that way, that was helpful as well too.
Right. And Piyush, the last question, I won't trouble you with too much on
Sure,
this.
sir.
How important were live sessions for you?
Uh, to be frank, sir, I was not available during the live sessions, but the discussions which used to happen, I used to see the recorded lectures of the same live sessions. So the discussions which used to happen, first of all, I would highly recommend to, even if you have time, to attend the live sessions, because that makes you more confident when you go for the DNB practicals into the Viva. Because asking where you're writing, no one is going to see you and you won't feel that demotivated. But when you are sitting in front of a examiner, even the things which you know, you will not be able to answer. So live sessions and interactive sessions are something which makes you more confident as a clinician, as a doctor, and to back your knowledge. So in that way, I think live sessions were really good. Unfortunately, I couldn't attend, but yeah, recorded. We are always being able to access the recorded lectures. So in that way, it was very helpful.
Right, Piyush. If you would not have been a doctor, what you would have become?
So actually, I could have been any. Means my second hobby was being a sportsman. But then, right from the childhood, it was my parents' dream. Not even my parents. Even it was transferring from my grandparents to the parents. But unfortunately, they couldn't fulfill it due to some financial issues. But that dreams had always been my dreams since then. And eventually, on the process of fulfilling my dreams, eventually I fulfilled their dreams as well. So it was a double bonus for me. So yeah, it feels great to be a doctor.
Fantastic. I just pray to God that through your hands, a
Thank you,
lot
sir.
of problems in the lives of your patients are healed, a
Yes, sir.
lot of deformities are corrected.
Sure, sir.
You will get mobility back to their life if they're missing it. You will make a lot of sports person achieve their dreams. You could not be one, but you will make a lot of sports person compete at every level for India.
Yes.
And more importantly, you'll serve the community.
Thank you, sir.
I think that this is part one of the interview, which will continue after a decade. When we meet again at a different level, we
Yes,
talk
sir.
about some surgery that Piyush gets to India, which
Yes, sir.
benefits the mass. Finally, it's aspiring to serve the humanity.
Sure, sir.
So congratulate your patient
Thank
on
you, sir.
the part of the entire team of Conceptual Orthopedics, and all the very best, young man. Enjoy
Thank
your
you, sir.
Bye.
Thanks a lot.
Thank you. Bye.